How to check your heartbeat. The number of times your heart beats in a minute is known as your heart rate. Your resting heart rate is the number of times per minute your heart beats when you aren't working out or otherwise stressed. The health of your heart muscle can be determined in part by your resting heart rate. Knowing how to monitor your own heart rate is beneficial for your overall health while exercising, or if you encounter symptoms like dizziness. Your resting heart rate is significantly influenced by your age and level of fitness. Your heart rate can be impacted by all of the following: temperature, body position, such as sitting, standing, or lying down, excessive use of coffee. You may check your pulse in a variety of methods. The most popular techniques are listed below. 1. Radial pulse. Using this technique, you'll locate the radial artery and check your pulse. Position your middle and pointer fingers directly below the thumb on the inside of your opposite wrist. Avoid using your thumb to check your pulse because the artery there can make it more difficult to count precisely. Count the number of beats you feel in 15 seconds after you can feel your pulse. To find your heart rate, multiply this value by 4. For instance, 80 beats per minute is equal to 20 beats in 15 seconds, BPM. 2. Carotid pulse. Using this technique, you'll locate the carotid artery and check your pulse. Position your middle and pointer fingers directly below the jawbone on the side of your windpipe. To readily feel your heart beating, you might need to move your fingers. For 15 seconds, keep track of the pulses you experience. To find your heart rate, multiply this number by 4. 3. Pedal pulse. Your pulse can also be felt on the top of your foot. The pedal pulse is what is meant by this. Position your middle and index fingers over the bone that runs down the top of your foot at its highest point. To feel the pulse, you might need to slide your fingertips slightly to either side or along the bone. C. After determining your pulse, continue counting the beats for 15 seconds. D. To find your heart rate, multiply by 4. 4. Brachial pulse. The brachial artery can also be used to assess your pulse. The most popular audience for this technique is young children. Rotate your arm so that your inner arm is facing upward and is slightly bent. Position your middle and index fingers on the side of your arm, between the pointed section of your elbow bone on the bottom and the crook of your elbow on top. Next, extend your fingers up your arm by a single inch. To feel your pulse, you might need to press forcefully. Count the number of beats in 15 seconds after you can feel the pulse. To find your heart rate, multiply this value by 4. Using an assistive technology to monitor your heart rate. Your heart rate can be determined by a variety of technologies, including blood pressure monitors for use at home, electronic activity monitors, mobile applications, fitness equipment. A wireless monitor that is fastened to your chest is the most accurate tool for measuring your heart rate. It transmits to a wrist-worn fitness tracker. Smartphone apps, at-home blood pressure monitors, and wrist-worn digital fitness trackers are all less precise than manually taking your heart rate. However, these tools are quite helpful when working out and fairly precise. Metal hand grips on exercise machines may be able to accurately monitor your heart rate, although these are frequently quite unreliable. The most efficient ways to monitor your heart rate while working out are manually or using a digital fitness tracker. What ought to be your heart rate? Although men tend to have slightly lower heart rates than women, heart rate norms are mostly based on age rather than gender. Adults should have a resting heart rate of 60 to 100 BPM. Athletes and other highly fit people may have resting heart rates under 60 BPM. You can employ target heart rates to optimize the effectiveness of your workouts and to keep yourself safe. It is usually best to exercise between 60 and 85% of your maximal heart rate. Exercise at the lower end of this range or interval training, in which your heart rate rises and falls, are both beneficial for burning fat. Building cardiovascular strength is best accomplished by exercising at a higher intensity. Whenever to visit a doctor. Bradycardia refers to a persistently low heartbeat. A low heart rate without any other symptoms is typically indicative of a very healthy heart muscle in fit young adults or trained athletes. A low heart rate, however, may indicate a serious underlying issue. Call 911 if you are suffering chest pain and your heart rate is less than 60 beats. Call a doctor if you experience fainting, weakness, dizziness, or any other unsettling symptoms. Tachycardia is a persistently high heart rate, more than 100 bpm while at rest. Exercise, stress, anxiety, being ill, or consuming caffeine can all cause an increased heart rate. When you're resting, a heart rate exceeding 100 bpm is not typical, especially if you're also dealing with chest discomfort, palpitations, palsy, weakness, headache, abrupt anxiety. Call a doctor if you experience any of these signs. The lesson. You can check your heart rate easily at home using a few different techniques. Your resting heart rate might serve as a gauge of your cardiovascular health. Knowing your goal heart rates and monitoring your heart rate while exercising will help you get the most out of your training regimen. A high or low heart rate can occasionally be a sign of a dangerous underlying condition, especially if it is accompanied by other symptoms. If you encounter this, call your doctor right away. Give this video a thumbs up if you liked it and share it with your friends so that we can continue to produce content like this. Click the subscribe button for more videos like this, and don't forget to activate the notification bell. Check out the links in the description if you haven't already. Thank you for watching.